Welcome back, and thank you so much for being here. In today's video, I want to share with you the results I've gotten from using the Oralift for the last 4 months. This is a mouthguard looking-like device I have talked about in several videos. If you have not seen them, I will link them down below. But as I said, I have been using this for 4 months. And in today's video, I want to show you my before and after pictures, which are quite incredible. To go over the before and after pictures with us and answer any question we might have on the Oralift, I invited the creator of the Oralift, Dr. Nick Mohindra, to talk to us. So in just a second, we will talk to Dr. Nick Mohindra, look at my before and after pictures, and as I said, answer any questions you had asked me about the Oralift and also questions I have on it. But thank you so much for being here.
It's a pleasure, Claudia.
Likewise. Would you like to introduce yourself?
Yes, I'm Nick Mohindra. I don't practice dentistry, but I used to practice dentistry, and I qualified in Edinburgh, and then I worked in various places, had practices in South Wales, and then our son got very ill, and he had to move to London to be near a London hospital. So I moved my practice to Ashford in Kent, which is quite close to London. This is where Oralift really started. What was really happening was, because of my son's illness, the hospitals pushed their boundaries to make him better. And then when we moved to Kent, he got into remission. And that made me think, what should I be doing? I'm not a dentist. And so my thinking was, well, whatever I'm doing, I must make sure I'm doing the best for my patients too. And this is really where this journey started. My first ambition as a dentist was to treat gum disease for my patients. Gum disease has got so many harmful effects. It's got health effects. People lose their teeth because of it, and they end up with all sorts of problems. And I wasn't getting the results that I wanted. So I worked hard, looked at the textbooks, couldn't find the answers, and then developed a method which would cure gum disease for my patients. Now, this was in the 1980s, and I introduced a brush called the interproximal brush. And now, in 2021, that's become the routine. But it's taken a long time for that to become the routine. After this initial work with gum disease, I started looking at patients with facial pain. There are a lot of appliances that we can use to treat facial pain, but one of them was called the pivot appliance. And I wasn't getting the results I really wanted. So again, I started reading textbooks, going to lectures, going to things and finding out about it. And then I developed a theory that perhaps it's not the appliance, it's the way our face is formed that is the real cause of the problem. So I developed a technique called the dental facelift. The device I was using, the appliance I was using to do this treatment is the precursor of Oralift. And what I found was that when I was doing this treatment on my patients, they were looking better, but not only were they looking better, they kept on looking younger for years to come. And therefore I realized it was having an anti-aging effect. And the funny thing was that I realized, and this was in the 1990s, probably late 1990s, I realized that appliance alone, without doing anything to the teeth, could also have an anti-aging effect. And that's when the Oralift was born. I decided I'll make my own appliance that will have this anti-aging effect, and that was the Oralift. And that was in, I think, 2002.
Wow, that's a great story. Now, I have to be honest, Dr. Nick, when I first got the Oralift, I have it right here, I didn't think this little device could do much. It's a little like a mouthguard device you put in your mouth, and I thought, what is this going to do? But we're actually going to go over my before and after pictures, which I find fascinating because when I look at myself in the mirror, I don't see the change because it's very gradual. But when I looked at the before and after pictures, I was like, wow, there's a huge difference. I can feel a difference. I can feel a difference in the way my face feels. And I finally stopped grinding at night. That just recently happened. It's
Oh,
huge
well
for me.
done.
Yes, it's very big. I wake up at night and I don't have the dead grip on my teeth. I also have noticed, and we can talk about that when we go over my pictures, my lips look fuller. I look in the mirror and I think, why my lips? They look really pretty. I feel that my vermilion border has come back a little bit. But those were the only changes I saw before I looked at the before and after pictures. So since I'm talking about it, let's look at the before and after pictures, and then we can talk about what sort of changes can happen with the Oralift.
The pictures, one of the amazing things about Oralift is we promote it for its anti-aging purposes. But remember where I started it was treating people with facial pain that really started me off on this journey. And now we find that this little appliance, the way we use it now, can have very profound effects. It can have an anti-aging effect on the face, all the things that happen with the aging process, how our faces sag downwards, our eyes get sunken in, our nose gets wider, cheeks get flatter, we get jowls. All these things can be helped by using Oralift. How? Facial muscles are very important. What they have is they have the capability to adapt to change. What does this process of adaptation mean? It releases a lot of chemistry. One of the chemicals that is released are anti-inflammatory biomarkers. These help with the healing of the damage that's been done by the aging process. But they don't only help with the aging process. If you've got chronic inflammation in the face, skin problems, sinusitis, they can help those as well. But obviously, because of regulations and whatnot, we can only claim the anti-aging benefits. Now, looking at your pictures, well, we can see how the lips look much fuller, how the face shape of the face is changing, the eyes look much better, they are not so hollow looking, and there are lots of improvements taking place.
I feel in the after picture, I look definitely younger than in the before picture.
Yes. One of the things is because you used to clench your teeth, the clenching makes our faces much squarer. Our jaws become much wider and they become squarer. And now, because you've stopped clenching and we're increasing your freeway space a little bit, the face shape is changing again. Face shape depends on how the muscles work. So clenching puts forces on bones, the bones start to change, our face shape changes. So if we look at your pictures of when you're in your 20s, we'll probably find that your face shape is now becoming more like when you were much younger.
Now, you were just mentioning the word freeway space. Tell us what that means and why that is so important.
Right, okay. When we are at rest and we've got our lips together, there's usually a gap between the top teeth and the bottom teeth. That is called the freeway space. Now, that gap can be, if your muscles are very tense, that gap can be only about 0.5 millimeter. If you're very relaxed, that space can be about 3, 4, 5 millimeters. On average, it is supposed to be 1 to 3 millimeters. When we put our appliance, the Oralift appliance in the mouth, our top teeth realize that it's not something that they can chew on and eat. Therefore, it sends messages to your muscles saying, let the jaw rest in a new position from a normal position. So it rests in a lower position, and that's when the magic of Oralift starts to happen. It's not just the facial muscles, it's the breathing muscles, the swallowing muscles, our postural muscles, all have to adapt. And that's where the chemistry, anti-aging chemistry, is released.
Yeah. And like you said, it's not just the facial muscles. I definitely notice now that I used to clench my teeth a lot. And I would do it when I was anxious, even when I was working out. But now I'm aware when that happens and I go, no. I have to have that freeway space. And not only does it relax my face, but it relaxes my whole being. It's really
This
interesting.
Yeah. The posture improvement that happens with Oralift is your head goes back, because as we age, our head comes forward. This takes your head forward, but not only your head, the shoulders, the tummy goes in, and it affects right up to I've seen pictures of where the hips are correcting themselves as well. So
Wow.
it's very powerful what our body can do. It's not the Oralift that is doing all this. It is you who's doing it. It's your brain and your body that's doing the work.
You created a great little device. Now, the device is born for 4 months in the beginning, and then you take a break for 4 months, right? And then you start the 4 months all over again. Can you tell us a little bit about the thought process behind that? Why is it born that way, and what happens in the rest time?
Okay. The two things we've got to be rules that are important is, because it is the process of adaptation, our jaws are starting to adapt to this new position of the jaw. The process of adaptation works, but if wearing the Oralift becomes a routine that you keep on doing all the time, then the body gets used to that and doesn't feel as if it's having to adapt. So that's one principle. We must have long rests in between the wear periods. The second reason is, when you wear the Oralift, the anti-aging effects that are introduce healing into the tissues of the face. Now, the healing process continues even after the initial trauma is made. Let me explain. If you cut yourself, you bleed, you get a little scab forming, then a scar forming, but the tissues underneath keep on healing for up to about 10 months afterwards. Mm-hmm. So even after 4 months of wearing the appliance, you'll find that the face will keep on improving, as long as you control the other factors of aging, which is stress and clenching and all the other things, diet, everything else comes into being as well.
That's a tough one for me, because I always think the more the better. And you have told me I need to start wearing the device less because I was having signs of overuse. So that's an important one we have to tell people, because it is so easy to use. You just put it in and relax, that it is very tempting to think, if I wear this more often, I get better or quicker results. But that's not necessarily so.
Once you've got your facial muscles in a very relaxed position, then how you use Oralift can be much more flexible. Okay. But to be able to get the muscles in a facial relaxed mode, you've got to stop clenching, you've got to control the stress in your life, you've got to have a good diet, eat good food, sleep well. Once all that is achieved, you can wear the appliance even more if you want. But till you reach that point, no.
Yeah, and I was trying to rush it. I was trying to wear it. Right. I thought, I'll do a little bit more and it'll go quicker.
This is a lifetime program. No need to rush,
Yes. Right. Now, one of the questions I get most frequently from my viewers is, does this help with jowls? Because that is something we're all concerned about at a certain age. So does the Oralift help with jowls?
Let's see why jowls are formed. Jowls are formed because the soft tissue sags, our muscles weaken, and everything's going downwards. Not only that, there are changes taking place in the bones. Our cheeks flatten, so therefore the sagging effect is even more. Because the Oralift is anti-aging, that is what happens. Everything starts to go upwards again. And eventually, I think even the bones will start to remodel. And that's why jowls will reduce. I've been using Oralift for over 20 years when I first invented it. And I look back at my pictures and I could see 20 years ago I'd got jowls starting to form. Really? But now...
No, you don't. You look fantastic.
That's right. They aren't there.
That's great to know, because that is the number one question I get. And then something else I want to address. I hear this a lot lately, and this is something I wasn't familiar with, that, as you said earlier, from clenching, our face gets more square. But what I have been hearing is that from age, our face gets more square, and that a youthful face has sort of this oval, this triangle of youth, which is what I actually see now happening again in my after pictures. So the Oralift helps with that as well, right?
Yep.
With that triangle of youth.
Exactly. The reversal of the aging triangle will give you that triangular shape of youth, you know. But we remember, Oralift isn't just working on, it's working on every aspect. The eyes look better, the skin looks better, because it is reversing all the changes that are taking place. I mean, I've got cases where I can show you even hair growth occurring.
Wow.
You know, people have reported their memory has improved, they can concentrate more. All these things, and all from this little piece of plastic.
It's incredible.
Right.
Now, you just mentioned the skin looks better. Let's look one more time at my before and after pictures, because one thing I noticed, my forehead, the skin looks very different in the after picture than the before picture. And I didn't even know it looked bad in the before picture. So let's take a quick look at that again. And if you can point that out maybe and explain why that happens.
Well, because the collagen underneath your skin is reorganizing, and therefore the skin is getting probably a little bit thicker and more elastic and much smoother. But the interesting thing on your forehead was, I remember when we took your first picture with the 5mm appliance, I saw a little patch down there on your forehead. I think it was due to some adhesions forming in the fibers, muscle fibers, or in the collagen. It could have been that you had a knock or something. Something happened that caused those adhesions. But you look at the 4-month pictures, they're completely smooth now. These are the black and white pictures that I was talking to you about. Yeah.
That is incredible. Now, why the black and white pictures? What else can you see in the black and white pictures that is more visible than in the colors?
What the black and white filter does is it cuts out all the makeup, the light problems, and lets us concentrate on exactly what the changes are. So a lot of times the black and white filter will let us see the changes more clearly than looking at the color pictures.
Okay, that makes sense. You are just incredible, Dr. Nick. I really enjoyed talking to you. Is there anything else you want to add about the Oralift or anything else?
One of the questions we ask is, if Oralift is so good, why is it more popular than it is? And one of the reasons is it's quite a disruptive technology. It challenges the way dermatologists treat skin. It challenges the way cosmetic surgeons treat faces. It challenges the way dentists work on our teeth. So it's quite disruptive, but it will become the norm. Any new innovation takes time, you know, and I'm sure this will become the norm one day as well.
I hope so, because it has done wonders for me. I am so grateful. Of course, I have to admit, I wanted it for the facelift, but the other reason I wanted is because I have ruined my teeth from grinding, and I have veneers and I have crowns. So I am so grateful for what it has done for me, not clinching anymore. And I wish I would have had it 20 years earlier, so I would have saved my teeth. But I'm grateful for it now, and I'm really looking forward to what other changes are going to occur.
Keep on using it. One of the main difficulties with forming a new habit is it's easy to fall out and forget to use it. But don't worry, our bodies are wonderful. Even if you started and didn't use it for a while and then you start using it again, remember the important thing is use the Oralift for the rest of your life now.
Yes. Thank you so much. Thank you so much for being here, Dr. Nick. I really appreciate it. And thank you so much for inventing this.
You're welcome.
I hope you enjoyed this conversation with Dr. Nick just as much as I did. I think he is incredible. And I am so grateful he invented the Oralift. I am just amazed at my before and after pictures.